Let's talk about the concept of what we're going to talk about. And as a farmer, raised as a farmer, I'm going to go back into history and talk briefly about the time on the farm. We had a neighbor who had the mental concept of, if it's not broken, don't fix it. My dad had the mental idea, don't let it break. So that correlates with the direction we're going today. When it's broken, we call it pathology. I'll use my left arm for that. Pathology. That's when something is wrong, something broke, the equipment doesn't work right. We can look at the part, we can see that the part is cracked, it's worn, there's something broken, there's something bad. On the right side, we talk about wellness care. In the wellness care category, you can think of prevention. In our society right now, the mental concept as a whole is wait till it breaks. Wait till you have a symptom. Wait till something goes wrong. And then you go to the doctor. The doctor does a diagnosis for the insurance company so he can get paid. And then he treats you according to the parameters of that diagnosis. On the well-care side, if you don't have a pain, something that they can diagnose, they say, come back when it's bad. Just we'll wait and see. That's my neighbor. Don't do anything until it breaks. Well, my dad said, the squeaky wheel gets the grease. And when there's a squeak, something's going to happen that's worse. Let's find it and fix it while it's minor. So the whole concept today is about looking for minor symptoms that have not developed yet into a pathology. I give a couple of examples. And a couple of examples are, first at the top of the triangle. I spent many years in Colorado Springs. We played a lot of basketball. When the adults played basketball, many times it turned into a fight. You probably never heard that before.
Oh, yeah.
Just like church ball.
Yeah.
That's what it is, church ball. So we had a problem with the men, obviously. The problem was not basketball. The problem was deeper. The problem was what was going on inside their mind, what's going on inside their life. They were under a lot of stress. And the way our stake dealt with that problem is they eliminated basketball for the adults. Now, in my opinion, I thought that was not a good approach because it did not do anything for the cause of the problem. It was broken. We didn't fix the cause, we just stopped it. So that would be the farmer taking the equipment out of the field and stop farming. My equipment's broken, we're just going to shut down the farm. Now, when do you do maintenance? On the farm, wintertime is a good time to do maintenance. So we pull the equipment into the shop, into the potato cellar where we had shelter. We would maintain the equipment. Do preventive, it's called preventive maintenance. And some of you have cars that maybe you treat like my friend, or maybe you treat like my dad, who don't want it to break down. So we do a lot of prevention. So what does that have to do with you and I and our bodies? A lot. So what are some of the simple things we can look for that indicate that something's functionally not quite right. It needs to be addressed. I'll give you right now a list of a few of them, and it's very common with children. I used to have parents bring their children in with a sore back or headache or some kind of problem, and I would always like to look at the shoes. Why the shoes? Because if the shoes are wearing crooked, you know, there's a problem with the ankle. There's usually a problem with the knee. If they have an ankle problem, a knee problem, they have a hip problem. If they do, they have a low back problem. If they have a low back problem, they have to have an upper back and neck and head problem, because it all works together. So an easy screen for a young parent or grandma and grandpa is to look at the shoes. So when you put your shoes by the door, I come out and look at them.
Yep, that's what she needs. A lift for sure.
Sometimes moms will say, she's gone through 4 pair of shoes in the last few months. It's the way she walks. Well, it's the way her hips work. So it's we can identify an early problem. So what do? We do what's called self-care, maintenance care, because you can't fix that kind of a problem with a one snap or crack or a wedge or orthotic or anything like that. It takes time, and you have to know what to do. Another thing, another example, yesterday I examined a fellow who was 67. I had to walk down the hallway and I watched his feet, I watched his knees, watched his hips, watched his head and shoulders. He did not move his arms. So he was walking, but his arms are like not moving hardly at all. So the lack of motion in a joint. In his case, lack of motion in the shoulder joints, in the neck joint, and down in the sacrum. So he had multiple problems. When they checked his vertical posture, he had more weight on the toes, which means he's leaning forward. His arms hung forward. It's very obvious to see this fellow has a long-standing problem. So I asked how long he had the problem. He said, probably 30 years. Well, guess what? He's lucky. He's lucky because it's still functional. It has not become pathologic yet. Nothing's broken yet. Well, that's what he said. Then we did more questioning with functional problems chemically. So we're looking at another corner of the triangle, a chemical corner. Do you have any problem with sugar? Oh yeah, I'm a diabetic. Well, that's broken. Something's not just functionally wrong, something's not working. And it's not just the pancreas, it's the head space in what to eat, when to eat, how much to eat. I said, you know that this is a diet problem. Oh yeah, what are you doing about it? I take medication for it. So it's treating the symptom, not the cause. Does that make sense? Okay, so back to the farm and your bodies. When does your body do most of its healing?
In the night?
At night. When you're watching TV?
No.
No.
When you're sleeping.
When you're sleeping. How deep?
When
you're dreaming. When you're dreaming, you're healing better than any other time. That's when babies grow. That's when teenagers grow. That's when you go from not quite healthy to more healthy. I had a lady this week, I said to her, you must have a nap. Do you? She said, no, I don't. I said, I recommend you have a nap. No, that was last week. Last Monday. She came on with her husband. I said, did you have a nap? She said, oh, did I ever? I slept for 3 hours.
she needed.
Was that a good thing?
Yes.
during the middle of the day. Now she felt guilty because she had a nap. That's like, the farmer that was gonna wait till things break. She did some maintenance care. She took the equipment out of the field, put the equipment in repair mode, did some fixing up. I said, did you have any change in your symptoms? She said, with a smile, my headache left. I've had headaches for a long time. Now, who would ever think that headaches were caused by lack of sleep? In her case, that was a deal. Now, she's not well, but she is now in the road to recovery, doing active self-care. Fast learning. So, I'm going to pass out this little quiz, well care versus sick care. We're going to start at the top and kind of go down through it. I have 2 handouts for you today. One we might not get to. The first one is a question, multiple choice. Who is responsible for my care? Choose. A, the federal government.
I hope not.
It seems like it's headed that way, though.
Wise politicians. B, profit-motivated pharmaceutical companies. C, medical professionals who are trapped between their education and the insurance companies and politicians. D, I am, with coaching help from appropriate professionals. Obviously,
D.
your choice is D. Now, I want to comment on C. A lot of people in the natural health field talk down about medical doctors and drugs and pharmaceutical companies. And the good news is most of them are very good people with pure intent. Most of them go to college and spend hours and hours and lots of money and lots of time and lots of stress to become a doctor, a healer. Then they get into real life practice and they get trapped between insurance companies and politicians. They then have to do things different than what they were trained to do. So I don't ever talk bad about them. We need them, and we need good medical people who are trained to do special care. In the United States, we have a lot of specialty types of medical people. When you need them, get the appropriate care. Now, in our class the other day, one of the ladies talked about a drug that has many, many side effects listed. So when she got the drug, it had all these side effects listed. In fact, her son is a pharmacist. And she said, I'm not going to take that because of all those things that could happen. Now, let me set your mind at ease about drugs. Just so you know, I'm not opposed to drugs. But I am opposed to mass, indiscriminate use of any kind of drug. That's what we have right now going on in the world. Mass indiscriminate use with the jab. When the drug company does testing to get a drug approved, they have to go through a certain length of time and a certain number of, I call them, we can call them victims,
Yeah.
monkeys, sheep, rats.
They have to test it on.
They have to be tested. Now, let's suppose we have 1,000. We'll use that as a guide. We have to do at least 1,000 trial with real people. And we have these real people and we pay them. That's common. You probably have all been solicited to do try a drug, and then they'll pay you. So you try the drug, and let's suppose we have a new one, and you have a headache. You took it, and you've had headaches before, but this is a different headache. So you know it's related. You happen to get constipated. you happen to get diarrhea, you happen to get joint pain, you happen to now not be able to sleep at night. So when they do the questionnaire, every symptom that was negative must be listed on the sheet. That doesn't mean you're going to get it. That means somebody did. So when you see all the negative things, just know you're not going to get them all. And some of them, like you have a headache, some of them may give you a worse headache. Some of it may be for the kidney, and now your kidney is worse. That's only a few. So just so you know, just because they have a big list, no saying they're all bad. So whenever you need to take a drug, and all of you probably will someday, only take it for a short time. If it works, it's going to work soon. Now, sometimes they say you have to take it for 6 months before it works. Personally, I wouldn't even touch that drug. I can't tell real soon, I'm not going to take it. Okay, going on. Number 2, well care focuses on function. That's a true statement. Not symptom only, but function. So when you watch somebody walk, you see how they're swinging their arms or not, when you see where they're placing their feet and they're different, there's some function that's not right. And when you have a foot flare or an arm that's not swinging, or one swinging a lot and the other one's just hanging, kind of hanging, know this always. If you have a faulty function of motion, faulty imbalance, right or left or forward, you do have faulty alignment. If you have faulty alignment, you have faulty organ function. So you can have a kidney problem because you have a knee problem. It's rotating the spine, affecting the nerve flow and the nerve function to the kidney. Now the kidney's just malfunctioning, but if it doesn't get enough nerve flow for a longer period of time, it gradually moves over and becomes pathology. But according to autopsy, most people at the University of Kentucky, they did studies and they did autopsies to find out why the people died. 98% of them had misalignment in the spine that affected the nerve that went to an organ, and the organ got weak, the nerve got sick, the organ died, and shortly thereafter, the patient died. All because of misalignment. So the structure and motion of the body, motion, balance, and alignment. Those three, motion, balance, and alignment, are key factors with the function of the entire body. Number 3, true or false? Sick care focuses on symptoms based with insurance parameters. True. Number 4, the mindset is different for both the doctor and the patient with sick care and well care. Obviously that's true. Doctors want to help you with a symptom to get rid of it. That's why you go to the doctor, have a symptom, or we get rid of it. They want the doctor to do something. Well care leans toward function and early identification of symptom. Number 5, which care requires the most faith?
Well care.
Which requires the most education? Sick care. You don't have to know how the body works. You don't have to know, you don't have to have an education to get well and to well care. you do have to have faith. And faith usually requires patience and time to let the body heal by divine design. That's why the book, to help you gain more faith in your body's ability to heal itself. Which type of care requires long-term, long-range habits to change? Obviously, well care. Going on, motion, balance, and alignment. MBA. Think of a Valentine. A lot of you made Valentines. We take a piece of paper and fold it in the middle and cut it around. And when you unfold it, both sides are the same. The body should be like that. We used to have in the office scales called bilateral scales. Your patient stood on the scale. One scale weighed 1 foot, the other scale weighed the other foot. They should be within about 5%. Not too much weight on one, not too much weight on the other. I'll tell you a true story. I had a lady who was driving a car with the seatbelt on, and she got rear-ended. When she got rear-ended, she got thrown forward. The seatbelt was tied. She had immediate back pain. They put an ambulance, took her to the hospital, did x-ray. 2 of the vertebrae in the mid-back had folded over the seatbelt and had a compression fracture. That means the bone had become shorter on the front, stiffed down. So they cut her open, opened it back up, pried them apart, and put plates on the side of the bones and put screws in, which was all needed, or the spinal cord would have been kinked, and she would have had more problems. So she lay in the hospital and recovering, and she kept saying, I have a lot of pain in my hip. They said, well, take this pill and we'll give you more drugs. And she waited and waited. I saw her and said, when you get out of here, come see me. I'm going to check your hip. And so she was in the hospital about 10 days. She came out of the hospital right to our office. She came in the office. She was limping. I knew she was in a lot of pain. I had her stand on the bilateral scales. She had more than 50 pounds different on one leg than the other. I said, okay, I'm not going to touch you yet. I want to take an x-ray of your hip. So we took an x-ray of her hip. Now, her hip, when she had the crash, she went forward and her knees hit the dash and shoved her leg back and broke off the femur head.
Oh.
So when I saw the x-ray, I said the femur head's different than the shaft. I said, okay, I have really bad news for you. Get back in the car, go back to the hospital. I will call your doctor, the orthopedic guy. I called him up and said, she's coming back. She broke her hip. No, it had been about 10 days, fractured hip. Guess what's going on in her body? A lot of breakdown, a lot of infection. So we went in and did the best they could to clean it up and paint it and stuff. Then she was recovering very slow. They took her from the hospital to an extended care facility. They kept her there for a while. Then they moved her into another place. In about 4.5 months, she died. From what? The infection that spread throughout her body in the hip. Now, that was a symptom that could have been and should have been looked at very, very closely. Now, why did I tell you this story? I told you that story because, again, sometimes there's more to any kind of problem than you think there is. So if you have any kind of concern, I'm personally very in favor of diagnostic testing. I would much rather have you be mad at me because they sent you off for an MRI and it was negative. So you come back and say that it was negative. There's nothing wrong with me and I'm mad at you because it cost me money. And he said, well, you can be mad, but I'm happy because now I know that it's okay. Like with her, it would be very easy to roll an X-ray machine and take a picture of her. Just so you know, Medicare spends many, many millions of dollars on prevention. You can get anybody on Medicare can get an annual exam, they can get checkups, and they like to pay to find out things early. The older you get, the sooner you die if you have a fracture. So if you think you might have a fracture, get it examined. At least a couple of views, and maybe CAT scan or MRI, depending on how bad and where it is. You want to have normal motion, balance, and alignment, all three. Number 7, normal balance motion is possible. Normal motion is only possible when the tissue is balanced and aligned. True. You have to have alignment and balance. Number 8, joints have the best function when they're mobile and aligned. Keep in mind, that's true. All joints are designed by God to have a certain shape. That's why when they dig up a skeleton, they can put it back together. They look at the shape, the size, and they say, oh, this is a finger. This is a toe. This is a femur, whatever. They could put it back together. So remember that. They all should snugly fit. They all should move some. Even the joints in the head. I talked to a lady this morning whose husband fell and his head, hard, had 15 stitches in his head. Then a few weeks later, he tripped and fell over backwards and have another groove in the back of his head with about the same number of stitches. Now, he spent time in the hospital because they thought maybe something was wrong with his brain. Now they did an MRI, they did a lot of different tests on him, and they said your brain is okay, but he still has pain. Guess what? When he fell, his sutures in his head probably jammed tight and were stuck. So I asked her, has he been examined to see if the sutures are mobile or not mobile? She said no. Well, I would bet a lot that when I check him, he's going to have a head that's skewed, not straight. And when the head is skewed, not straight, and not moving, it's like a swing set in the park. If the swing set is crooked, guess what's going to happen to the jaw? The swing. It's not going to swing straight. So many times, again, on the functional well-care side, if a person says, my jaw clicks, I have jaw pain, that's always an indication that not only is the jaw crooked, the head is usually crooked. And people who go to the dentist, they have the mouth propped over for an hour or so, and they were working on one side and then pushing and pulling and twisting. They will usually mess up the swing enough that it affects the swing set. So that's a good thing to get checked to make sure the head's moving properly. And what can you do for that? I've shown you how to do the occipital release. If you go to the dentist and have any kind of work done, do the occipital release, do the microcranial mobilization, okay? Do the maxillary spread to help your head get as good as you can get it. Put it back into motion and alignment. Number 9, spinal fusion permanently modifies motion and balance. True. I'll give you a couple of examples. I had a patient who was born with 7 vertebrae in his back fused. They were stuck. He was crooked and he had long legs, short torso. Was told by a couple of doctors, specialists, that he would probably not live to be 25. His name was Randy. Randy came to see me. I took X-ray of his spine and said, "Oh, you have congenital fusion, but what about above and below?" He said, "Well, they went back in and they fused above and below. So they took a bad problem and made it worse, because now is the vertebra above that one and below that one now have to move more." Okay, so to make a long story short, I did the same approach on Randy. I said, "Randy, we need to get your head back in the middle. We need to get your spine neutral. And when it's neutral, it will remodel. Your tissue will remodel or better than you have been." So I gave him a lot of homework. He was very faithful in doing his homework. And he got better and better and better. Had less pain, had more motion, more function. And then the turkey got married and moved to California. I didn't hear from him for like 3 or 4 years. And I got a card from him that said, "I'm doing great. I'm still doing all the self-care. Oh, by the way, I'm skydiving, I'm golfing, I have 2 kids." And the last I heard, he was like 35, as happy as can be, even with the fusion. Now, back to fusion. Whenever we do a neck exam, a real thorough neck exam, we take a picture of the neck neutral, that means straight ahead. Then we have them bend and bend back. Then we draw lines on the bottom of the vertebra and see what they do. With a normal neck, the lines will converge so they all come down to a point. When they bend your head down, they flare evenly. What happens when they do a fusion is they mess up the flare. So now if those 2 segments are fused together, whether it be the neck or the low back, guess what happens to the one above and the one below when you move? Answer, they have to move more. You know, instead of all them doing their share of the motion, they have to do more than their share. And guess what happens when they do more? Back on the farm, if something is wobbling, what's going to happen? It's going to wear out more quickly, or it's going to break because it's moving too much. The same is true in the body. So only have a fusion when you absolutely, that's the last choice. Knee replacement, number 10, is almost always related to spinal complications. That's true. Number 11, sleep is usually the most beneficial with optimal body, motion, balance, and alignment. True. I saw a fellow this morning that's sleeping on his back with a big neck pillow and a hot pad. So his neck is stretched forward. He came in and said, "I have a lot of pain in my neck and back and shoulders." Guess what? He's making it worse every night. With a high pillow, heat for a long time is not good. Heat for a short time reduces pain, but for a long time, no. So about 20 minutes, take it off. Change. You can take it off, put it back, take it off, put it back. Every hour if you need to, because pain helps subtract pain and help many times increase the speed of healing, but not all night with a stretch. It would never get better.
The half neck roll,
Yes.
Is that an okay position for lying on your back?
Yes, because if a half neck roll or a towel rolled up, some kind of a cushion to support the normal cervical curve is good.
Okay.
Now I recommend, if you do that, favor the center of the roll more low, like closer to the shoulder than the head. We don't want the head tipped up. I recommend that you have it high enough that when it lifts, it creates a minor separation of the disc and the joint to help increase fluid in the joints. We don't want to have it too low so it's flat. Okay. Number 12, Lack of motion, balance, and alignment accelerates degenerative changes. Obviously, that's very, very true. Number 13, active repetitive microtherapy is essential for optimal health. That means you have to be anxiously engaged and do something positive to help the body. I like to use the word facilitate, to facilitate normal, natural recovery of the tissue. And another thing along that line, keep in mind, when you have any tissue, whether it be a kidney, a lung, a hip, a muscle, anywhere, a tendon, a ligament, you're not going to fix the broken part. If it's pathological and it's gone bad, this is where repetitive microtherapy comes into play. So I've said to you, we can't teach an old dog new tricks. That's the old tissue that's bad. What we can do is we can train the puppies, the new ones, so we wait for and watch for new tissue to grow and treat it always according to tissue tolerance. If you have a puppy, the puppy's not going to know all the rules, and it's not going to be able to do everything that a full-grown dog or tissue can do. So it has to be only trained according to its strength. That's what you do. Repetitive microtherapy. Do a little bit of therapy often. I saw a fellow this week who bought a T-zone at Sam's. He had no instruction. He just bought the machine, took it home. He said, I love it. His wife's mad because he bought the machine. She doesn't use it. I said she will when she learns what I can do for her. I said, how do you use it? He said, I turn it on 99 and stand up for 12 minutes. I said, okay. I'm glad you came.
Wow.
I'm going to teach you how to use it so it does appropriate therapy. So even a good tool like the hot pad on the neck, it feels good, but you're doing damage. The T's on the high speed for full 12 minutes is re-injuring. It won't get better doing that. It has to be used according to the tissue need at the time. That's very important to remember. Now I'm going to pause and ask if do any of you have any questions about what I've said so far today.
So I do. So it sounds like sleeping on your back is likely the best thing if you can make that work. Because on your side, the alignment is tough to get straight.
That's a good question, and part of the answer lies in the design and quality of the mattress.
Okay.
The design and quality of the body. If the body is like a baby's body is really flexible. They can sleep on hard surface or they can sleep on a soft surface, and it doesn't make a whole lot of difference. When a girl starts to develop and they have more hips, then they need a different configuration. Now, back is a good position, but back is not always the best, because many times people who sleep on the back are on a bed that's too hard, so they don't sink in. You know, if you're laying the back, the bed should be level, first of all, level, not tipped. Should be soft enough that the rear end and the shoulders sink in a little bit, and the knees be lifted a little bit, so the more of a soft. If you turn to your side, you may need more. For a man, you may need more firm because you're more straight. The bottom line with posture is if you're sleeping on your back, you need to support the neck, not the head. A slight amount. I recommend something small behind the knees to, when you raise the knees a slight amount, you relax the muscles in the pelvis and the low back. If you go too far, you stretch the muscles in the low back. That's not good. So only slightly bend. Now, if you turn the same body on the side, now we want the knees slightly bent still. We want the slight bend at the waist. We want the torso straight. We don't want the head tucked. If anything, we want the head neutral. Neutral means looking straight or slightly elevated to enhance the neck curve, and not low if you're on your left, or high either side. You want the neck, the head to be in line with the body. Does that make sense?
Yes.
I recommend you change positions during the night, just like I recommend you change shoes during the day. Give your feet a couple of different options. Barefoot, slipper, harder shoe, higher heel, lower heel. Give your foot, ankle, knee a variety of support. Same with the body. Give it a variety. I think it's good to lay on one side, then lay on the other. I think it's good to lay on your back. All of them are good.
Okay.
It's never good to lay on the stomach. People who lay on the stomach and with the head turned will never be at optimal health. They will always have problems because they've torqued the spinal cord. Now, don't misunderstand me. The spinal cord can be torqued both ways. In fact, when you're on the T-zone, you can turn the head and torso one way, turn the pelvis the other way. Then change it to opposite. That's good therapy. But don't stay there for 2 hours. A lot of people who have problems sleeping on their stomach have the problem not because they were on the stomach, but because they were on the stomach too long. And they develop a torqued posture which affects everything.
So what do you put under your knees if you're going to be on your back?
Small pillow. Just a soft, small pillow. Now when you sleep on your side, I like to recommend you put a pillow between your knees and feet to keep your body from putting one knee in front of the other one, rolling at the pelvis. Again, when you roll at the pelvis, you're torquing the spinal cord. We don't want to torque it. If you have a pillow between your knees and the feet, you can lay on your side and keep your body neutral. Thank you for asking that question.
And what was the name of the mattress that you recommended?
Natural Farm. Natural Farm.
Okay.
Natural Farm was designed specifically for rest homes and Medicare to prevent bed sores. Because when you lay on the Natural Farm mattress, you have perfect contour regardless of your body size, regardless of your body weight, because it has multiple compartments that have air in them. The air amount in each tube is controlled by ambient air. In other words, there's not a pumping pressure like the sleep number. The sleep number you can set how tight you want it. With the Natural Farm, the body design determines how far you sink in and how you don't. And if you change positions, it will change during the night. It's active. You can go online and look up Natural Farm. Their mattresses are made in New York. I've been to the factory. I had a lot of people who in Colorado bought the Natural Farm beds. That's what we have on ours. And Hilton Grand Vacation used to have them, and Hilton Garden Inn Used to have them in almost all the hotels. The Canadian government has socialized medicine. They put them in all the rest homes because it lowered the costs of care a lot, because nurses didn't have to come and roll a patient over to prevent them from getting bed sores. It eliminated nurse care, eliminated inflammation, because people in rest homes, they get a bed sore, they can get infection, they can die from the infection they got from the bed sore. It's a big, big deal. So a natural farm company, once they developed that mattress, grew tremendously. Now, it's been a few years since I dealt with them directly, but I do know that they have sales on holidays. I do know that you can get a mattress, they'll ship it to you right to your door. They're light because they have air, they're easy to move, and you can try them out for up to 100 days. If you don't like them, you save the boxes, cost you $100, you send them back. So it's a kind of a low risk. They come in all different sizes. So if you're interested, look them up online. They're there.
My husband and I bought one last year to replace our bed.
You like it?
Fantastic, yeah. And they're really great to deal with. So
The what?
they're very nice to deal with.
Good.
And the people delivering will bring it into your house for you, just into the entryway. So
Yeah, we
they're
had,
good to deal with.
they're good. They're good.
Yeah.
Okay, so we have a few minutes left. I passed out the sick care, the self-care, sick care. This is mostly for your review. It's kind of a quick summary of things we talked about. Now I want to talk about one other thing for just a few minutes. That's the tongue analysis. The tongue analysis. If you go online, you can find different maps of the tongue. This is one. This is one map of the tongue. They're not all exactly the same. What I want you to learn today is you can tell a lot very quickly from the tongue early. The tongue will show weaknesses early before pathologies develop. Now, to study the tongues, I would encourage you to look at a lot of tongues, especially on young people. Ask them to show you the tongue. Here's a tongue that looks pretty good. Okay? Now, this tongue, I'm going to pass these around. This tongue is not quite as good. You can tell by the color. It has some white on it. It has a little bit of crack in the middle. When federal agents are trained to track down counterfeit money, they're never trained to look at counterfeit money. They're only trained to look at normal, legal currency in all denominations. So they study the look, the color, the lines, the pictures, all that stuff. They look at hundreds and hundreds of them. So when they say one that's normal, they say that's good. When you do that, that's what I'd like you to do with the tongue. I'd like you to look at a lot of tongues. Look at young people. Then you start to see more problems develop. You start to see cracks in the tongue. The cracks start to show up in the middle. In the middle is more the digestive system. So when you think of the digestive system, look how the crack gets deeper. The crack in the middle of the tongue goes the groove gets deeper. Then the groove gets wider, deeper and wider. The more deep and the more wide, the more chronic the problem is. Now this tongue happens to be a 32-year-old girl.
Oh,
Now, you'll see the same thing I do when you look at that real close.
Yeah.
You say something like, ooh, that's bad. Is
No, I
that,
forgot what the white is,
Lungs.
when it's white, covered with the
The
white.
more white it is, the more congestion there is in the lungs, the lymphatic system. Sometimes yeast will grow on the tongue because there's too much sugar in the body. The body's not getting rid of it. We don't like the white, we don't like the chalky pasty look. That means that we have a lot of cleansing to do. Then finally we look under the tongue. Under the tongue, you should not see the bright purple lines.
That's the liver, right?
I call it the liver lines. When the liver, like an oil filter, gets toxic, has not been able to keep the blood clean, then it starts to show up more. Then it finally gets wider and starts to protrude. It means it sticks out. So when you see one that has the liver lines are protruded, it's very dark, that's when I would say to you, you would benefit, if you like, due to coffee enema. Coffee enema helps clean the liver. That's a whole other discussion. The coffee enema is not designed primarily to clean the colon. It's designed to help your body clean the liver. So, what I've told you today about the tongue, you can look in the mirror, you can identify problems. So what if you have a problem? If you have a problem in an area, you support it. You support the tissue. If it's in the gut, you add after GI, you add the Flora Plus, you add digestive enzymes, the BFF, whatever you need to do to strengthen the tissue. And you subtract food. When the gut is in trouble, don't work it hard by feeding too much food. So quantity of food can be more damaging than quality of food. We know that if you think about what they eat around the world. A lot of people in underdeveloped countries eat things that you and I would never touch. They live on them. And they eat a small amount. They get a lot of nutrients from them. In America, we eat too much. That's why we have so many problems start in the gut. That's why the tongue is such a good tool. I give a class on death begins in the colon. And that's true. And it's not because the colon's weak, it's because people eat too much and they have misalignments in the spine. Thank you. Thank you. Thank you.